student who is about to graduate in July, and I am working as one of her advisors. And so I invited her to just sit in to see how this goes. So thank you for allowing them to sit in.
Great. Thank you for bringing them in. Thank you. Glad to have you.
Kevin, we are good to go.
All right, great. Well, I want to welcome everybody to the City of Charleston Health and Wellness Advisory Committee meeting for Wednesday, June 5th, 2024, start of summer. It's going to be a warm day today. A lot of people are excited for graduations and summer vacations and all of that. It's a great time of year, and but I know it's busy for a lot of you, so I just want to say thank you so much for sharing your time. Your time's very valuable to us, and I know your time's very valuable to you, so we appreciate you jumping on here and being a part of our meeting this morning. First on our agenda, we need to approve the minutes from May 1st, 2024. Can I get a motion to approve those minutes, please?
I make a motion.
We have a motion to approve the minutes. Can I get a second, please? If not, I'll second that. Any further discussion on the meeting minutes from May 1st? If not, all in favor, please say aye. Aye.
Aye. Aye.
Any opposed? Okay, the meeting minutes have been approved from May 1st, 2024. So next up, we have Tri-County Health Data Walk for Infectious Diseases. We have Emma Frazier, the Low Country epidemiologist from South Carolina DHEC Community Engagement Team. So if you would, Ms. Frazier.
Hello, everyone. Let me see if I can get my PowerPoint up. We just had it up. Can you see it on the screen?
We don't see it yet.
Hit your share screen. We practice this, so we know it works.
Yeah, we know it works. Let's see. I'll go back to, I did hit share from the Zoom. Let's do it again. Share. Can you see it? No?
Not yet.
Oh, wow.
If not, Dr. Frazier, I'm able to share your presentation as well.
Okay. Okay, we'll go with that. We practiced it and I knew we had it down packed, but thank you. Go ahead. I'll close this.
All right. Is everyone able to see that?
Yes.
Okay, perfect.
Thank you, Louisa. I'll put that in this. Yeah, great. Good morning again. Next slide. Our presentation this morning will provide basic information about examining infectious diseases in the Tri-County and state. The purpose of this presentation, one, is to provide a brief overview of infectious diseases in the Tri-County area, number one. Introduce selected data that reflects on the current status of infectious diseases in the three counties, Berkeley, Charleston, and Dorchester, as well as the state of South Carolina. We want to acquaint our partners, meeting attendees, and officials about the work that DHEC is doing to understand the health issues and educate the public about these diseases in our communities. Our outline, we will cover after the purpose, a little bit about infectious diseases. We'll talk about HIV/AIDS, provide some data about prevalence, incidence, and talk about CDC's continuum of care. And lastly, discuss sexually transmitted infections. And we want to focus on chlamydia, gonorrhea, and syphilis. Next slide. So what are infectious diseases? Infectious diseases are referred to as communicable diseases often, In general, they are illnesses that are caused by harmful organisms or pathogens. For purposes of this discussion, we will briefly discuss the 4 pathogens listed here. First, viruses. Viruses are pathogens that are smaller than your cells and have no way to reproduce on their own. They often get inside our cells and use our cells' machinery to make copies of themselves. Examples of viruses include HIV, AIDS, COVID-19, influenza, and hepatitis, to name a few. Bacteria are single-celled organisms that are all around us, and these bacteria are generally harmless, but certain bacteria release toxins that can make us sick. And these include things like strep throat, salmonella, tuberculosis, whooping cough, and particularly our STIs that we'll cover today, chlamydia, gonorrhea, and syphilis, are all caused by bacteria. Fungi live in and on our body. Examples of fungi are ringworm, fungal nail infections, thrust vaginal yeast infections. And lastly, parasites use the bodies of other organisms to live and reproduce. And examples of parasites would include some of the worms, protozoa, and another example would be malarial parasite. So these are just a few examples to give you an idea of infectious diseases as a whole. Next slide, please. Today we'll focus on HIV/AIDS and STIs in the Tri-County and state. Next slide. Most people are familiar with this, but I thought it was helpful to give a brief summary. What is HIV? HIV stands for Human Immunodeficiency Virus. It's a virus that attacks the cells within our body that help us fight infection. It makes the person more invulnerable to other infections and diseases. In general, HIV is spread with certain bodily fluids of a person with HIV. It's spread with the bodily fluids of a person with HIV, commonly spread by unprotected sex, having sex with someone who has HIV and is not taking HIV meds to lower the strength of the virus, and lastly, through sharing injection drugs. There is no cure for HIV. However, it is treatable with medication. Today, there is antiretroviral therapy, or ART, and it is, if taken as prescribed by a physician, HIV medicine can reduce the amount of HIV in the blood, i.e. viral load, to a very low level. When that happens, we have something called viral suppression that we'll also mention later in the talk. So what is AIDS? AIDS is acquired immunodeficiency syndrome. And AIDS occurs if a person has HIV and it is left untreated. Then HIV can potentially add to AIDS. A person with HIV is considered to have progressed to AIDS when the number of their CD4 cells fall below 200 cells per milliliter of blood, or they develop one or more opportunistic infections regardless of their CD4 count. Next slide. Now we want to focus on the data. These data slides were shared earlier in the data walk, so we've modified them slightly and want to bring you up to speed with them. The first set of slides look at HIV/AIDS. This particular slide looks at newly diagnosed HIV/AIDS cases. And you see in parentheses, incident cases. When we talk about incidents, we're talking about new cases of a disease that has occurred within that representative year. So in this case, we're looking at all of the new cases that occurred within our state itself, the dark blue line that goes from 2012 through 2021, and light blue line, Charleston County, Berkeley, the green, and Dorchester, the pinkish. So in this case, we want to look at rate. We decided to look at rate per 100,000 population. When we look at rate per 100,000 population, it's a method to standardize our population data. And we standardize it so that now we can easily compare apples to make this comparable as apples to apples across each of the years. So all of the statistics that I'll present will be on rate per 100,000 population. When we look at the data for the 3 counties and the state, we see that in 2021, Charleston County has consistently had the highest rate of new cases in the Tri-County area. It's also consistently had the highest rate from 2012 through 2021. And the rate in Charleston County exceeds the rate in the state of South Carolina. Next slide, please. This slide looks at prevalence. Prevalence refers to the total number of cases of, in this case, persons living with HIV/AIDS. It refers to the total number of cases that are current new cases plus any existing cases prior to that time period. So when we look at prevalence, we look at all new and existing cases. This, we're looking only at the year 2021, which gives us a check, an eyeball, or a view of what are the number of cases since we've been recording data for HIV/AIDS. When we examine this chart, we see that for non-Hispanic Blacks, they have the highest rate per 100,000 for prevalence throughout in 2021. The rates are highest in the Tri-County as well as in the state. For Hispanic or Latino, the rates per 100,000 population was highest in Charleston County, and the rates in Charleston County were significantly higher than that within the state of South Carolina. Next slide, please. So this slide looks at HIV/AIDS continuum of care. The continuum of care is a concept that was developed to look at how we are providing care for a patient over a period of time and across the spectrum of care. Looking at the fact that we've added art, we know that art will preserve the health, quality of life, and life expectancy of people living with HIV. And one of the things this continuum of care does is look at what's happened in these main 3 components as an individual remains HIV positive. Are they taking their medicine as prescribed? Are they keeping an undetectable viral load? And I'll walk through the 3 that we have here. 3 important measures. Number 1, received any care. In received any care, we look at what is the percentage of persons with diagnosed HIV who had at least 1 viral load in the past 13 months. For the data that we have here, the highest percentage is in Berkeley County. Then we also want to look at next, who is retained in continuous care. Retained in continuous care is defined as individuals who had 2 or more viral load tests per year that were at least 3 months apart. In this case, we see that Dorchester had the highest percentage, followed closely by Berkeley County. And lastly, virally suppressed, as I mentioned earlier, is measured as an individual who had a viral load test as a result that showed a result of less than 200 copies per milliliter. For virally suppressed here, we want to look at was the person virally suppressed at the most recent viral load test during the measurement year. CDC also states that viral suppression with the copies, 200 copies of HIV milliliter of blood suggests that people with this lower number can live longer, have healthier lives, and not sexually transmit viruses to others. And again, we basically make known the term U equals U, meaning undetectable equals untransmissible, meaning that if people living with HIV who have an undetectable level of virus in their blood due to treatment, they then are unable to transmit the virus to their partners. Berkeley has the highest rate compared to Dorchester with 69%, the second highest rate there on our chart. Next slide, please. So we'll look at the 3 STIs next. The first we'll look at is chlamydia. And here we're looking at only 1 year of data. So we're looking at what is the number of new chlamydia cases, in this case stratified by race, within each of the 3 counties and the state. We see that Blacks consistently had the highest rate in the 3 counties, and Charleston County has the highest rates in the Tri-County area. And chlamydia rates, we keep into account the fact that it's not difficult to treat, but if left untreated, it could lead to more serious problems, number 1. And number 2, because the symptoms are not as severe, such as genital pain or discharge from penis or vagina. So often when someone has chlamydia, it could be mild and they could miss the fact that they are infected. This highlights the point of why regular screening for STIs are critical and paramount. Next slide, please. Gonorrhea is displayed here. Again, this is looking at strictly new cases of gonorrhea within the 2021 year, and this is listed by age group. And we see that rates are highest in the 20 to 24-year-old age groups, and the rates in Charleston and Dorchester counties are close. Again, some people would have gonorrhea and not know it, and it highlights the fact that gonorrhea, as the other STIs, we must be vigilant of being tested for STIs. Next. Total syphilis. This looks at total syphilis infections, and this is graphed through 2012 to 2021. One thing that you see is how the rates of total syphilis is increasing over these years. Syphilis itself is divided into stages. Primary, secondary, and latent are the 3 primary stages. Primary and secondary syphilis are the stages where syphilis is most infectious. If the person remains untreated at the secondary stage, this can lead to latent syphilis. And latent syphilis is a hidden stage where you have no symptoms, and this can last for many years. So what we see in the rates, I'm sorry, back up one more time, please. The rates highest in Charleston County, then in Berkeley or Dorchester, and the state also have a significantly high rate here for syphilis infections. Berkeley and Dorchester are running neck and neck. Though not displayed in the chart, we want to mention that congenital syphilis has significantly increased in the past decade. And congenital syphilis is when a woman passes syphilis to their babies during pregnancy. And in the US itself, more than 3,700 cases were reported in 2021. So it's become a major issue within the states. Next, please. In summary, while these infection rates have been presented, they require and beg for more detailed review and consideration. We need to look at the impact of social determinant of health factors. We also need to look at this data by zip codes. We need to look at rural versus non-rural areas. We need to look at ability to receive or get to medical care, and also what type of insurance coverage people have to make sure that they are tested properly. And lastly, continue to share. We want to make sure that we continue to share information with communities and partners to better understand the impact of infectious diseases and do all that we can to reduce that impact in our community. This is a focus of DHEC, and my colleague Louisa is going to talk about a couple of the programs where we have been committed to sharing that information with the community and working to see how we can help reduce the number of infectious diseases, particularly our STIs and HIV/AIDS that we have that are ongoing in the community. Thank you, and I'll turn that over to Louisa. Thank you, Louisa.
Awesome. Thank you, Dr. Fraser. I will share my half of the presentation as well. So good morning, everyone. I'm going to be presenting today also on behalf of the community engagement team, focused on Fast Track Cities, what that means, and also Tri-County SHAPE, which is a sexual health coalition in the Tri-County area. So what is Fast Track Cities? Fast Track Cities is an international initiative between cities around the world. So this is a global partnership where they're supported by 4 main partners, one being IPAC, which is the International Association of Providers of AIDS Care, UNAIDS, UN Habitat, and the City of Paris. So Charleston joined as a Fast Track City in 2019. I believe there are only about 50 cities in the United States that have joined as a Fast Track City. And what that means is that we signed a Declaration of Paris, is what they call it, which commits 7 things. So I'll briefly go over the 7 things in the city. It is to end HIV epidemics by 2030, put people at the center of that initiative, address the causes or risk of vulnerability and transmission of HIV and HIV-related epidemics, use HIV response for a positive social transformation, building and accelerating appropriate needs of the local area, mobilizing resources for integrated public health and sustainable development, and then also the unification of leaders within the city and the cities that are partners worldwide. And so in 2020, when we signed the Declaration of Paris, we agreed to the goals that were 90, 90, 90, or in 2019 when we signed, the goals for 2020 were 90, 90, 90. And I'll kind of explain what that means in just a minute. But I do want to share that they updated their goals to be 95, 95, 95 by 2030. And so this is straight from the Fast Track Cities website, where it displays where in those number targets we are as Charleston, the metro area. And so for us, 84% of people with HIV know their positive status. So that's what that first 95 goal is supposed to be. We want to reach 95% of people that are HIV positive knowing their status. So right now, Charleston is at 84%. Following that, there is 74% of those people that are HIV positive on treatment. So that would be the antiretroviral care that Dr. Frazier had talked about previously. And then from that, we have 87% of those people that know that they are HIV positive are on treatment. They are virally suppressed, meaning that they are not able to transmit HIV to any other partners. So as you can tell, we've gone a great way, but we are still far from the 95 goals. It's not unattainable, but it's still something we have to work towards. And so how do we support Fast Track Cities? One of the main supports behind Fast Track City is our SHAPE initiative. So SHAPE stands for Sexual Health, STI Awareness, Prevention, and Education of the Tri-County area. And one of our goals within SHAPE is to directly work towards the Fast Track City standards, that 95 goal. And so we do that by promoting safe sex practices, dismantling stigma, and just engaging with the community through different events and projects that I'll kind of show on our next slide. A couple of flyers. So one of the ways that we do that is by promoting a free testing day every month at most all health departments around South Carolina, DHEC health departments. So every month we have a different flyer. We have a general calendar as well that states the date when we will be having the free testing day. So those are no cost to any individual that comes in on that day. And so this month, June 25th, we're going to be doing that for National HIV Testing Day. So people can schedule appointments or they can come walk in, and we love to promote that to anyone in the community. And then also, I also want to plug that we have a really fun and special project going on today at Common House Ale Works. This has been long time, in the making, and it's going to be super fun. It's a condom fashion show. So one of the ways that we like to dismantle that stigma, making contraceptives a little more normalized and just easier to talk about. We have 10 teams from people in the community making a formal fairy tale themed costume entirely of condoms. So I've taken a sneak peek at some of the costumes and they're very, very impressive. I want to invite everyone that's on this call, if they happen to be around or a little more interested in learning about the things that SHAPE puts together. This is a great opportunity to see people engaged with the content that we put out. So those are just a couple of the ways. We're also going to be, holding our annual World AIDS Day vigil, and then we are present at a lot of the Pride events that are taking place in North Charleston this week. So we really like to be out in the community, just kind of promoting safer sex practices in any way that we can. And so another way that we like to get support for Fast Track City is the mayoral support. And so one of the distinct components of Fast Track City, and this is a direct quote from the IAPAC network, they ask for the active engagement of mayors and county executives. And so we had a lot of this at the very beginning when Charleston first signed back in 2019 as a Fast Track City, and we'd love to be able to continue this moving forward. One of the things that definitely is on the to-do list is to see if we can get an update for our Charleston page on the Fast Track City website. Currently, there's a quote and a picture from our past mayor, Tecklenburg, and we'd love to get an updated one from Mayor Cogswell as well. And then in the past, we've done things like speakers, a mayor speaker at the World AIDS Day Vigil, getting support for those that are HIV positive with public housing and different press releases and such. And so that's all I had today over Fast Track Cities. As we can probably see from the numbers, we are I think numbers that are very doable to reach that 95, 95, 95 goal, but we still have quite a ways to go. Thank you, everyone.
Great. Thank you, Louisa. Thank you, Dr. Frazier. Any questions? Dr. Frazier, I have a question, I guess. These statistics are going through 2021. When do we see the 2022 and 2023 numbers, I guess?
Thank you, Kevin, for that question. We are working with our, excuse me, our STD division, and our numbers are in the process of being updated now. We do have some of those numbers, but we want to verify and double check them before they're released. And in the very near future, and I can't say exactly when, but I'm sure sometime within the next few months, we're going to have the 2022 data posted.
Okay.
The 2023, what generally happens is once you've collected that year's data, you still need time where you're updating for date updates that are coming in from other states. So if the person lived in South Carolina and was treated in another state, then that information is transferred in. So to get the year's data, it's always a lag, but we're close with the 2022, which I hope we'll have fairly soon this year to release.
Okay, great. Well, thank you. And I know on those, you know, on the charts that you showed on the HIV, Charleston County seemed to be much higher than Dorchester and Berkeley counties. Is there anything we can do for those of us that are in the city of Charleston government, anything we can do to help with that?
Our partnering, I don't know if you want to chime in, Dr. Richardson, with some thoughts there. We're actually working through a lot of the different community efforts to engage, and I can't list exactly what they might be. I think Dr. Richardson may be better suited to respond. Are you there?
I am here, and that's a great question. Thank you for posing it. I think one of the things is Louisa mentioned is stigma. And I think around not only HIV, but also sexually transmitted infections, stigma really prevents people from going in and getting tested. And so helping to decrease that stigma around those infections, that they're infections just like anyone else has, an infection that may be, you know, strep throat or chickenpox or that sort of thing, and that all of those sorts of symptoms require evaluation by a provider. We also have work to do with our providers to help providers to be able to take a better sexual history and ensure that they're doing all the screenings appropriate, that they know the recommendations from the CDC, that everyone should have an HIV test, that everyone that's younger or has new sexual partners should be tested for sexually transmitted infections. And then we have a whole group of people that know that they are living with HIV, but are not in care. And that stems from stigma as well as access issues. And so I think helping the city and those on this call that are our partners in helping to elevate helping to decrease stigma and elevate the fact that there is access to testing, the free testing days that Louisa just pointed out, the next one being June 25th at all DHEC clinics. There are other resources in the area for free or reduced cost testing for HIV as well as STIs. And then elevating some of these days, like there's National HIV Testing Day. That's why we're having the free testing event at DHEC. There are also awareness days around certain groups, like women and girls or African Americans who there's certain days to bring awareness to disparities in HIV prevalence. in certain groups. So those are some of the ways that I can think of off the top of my head. And then, of course, the city, as Louisa mentions, does have housing funds that are used in part to support those living with HIV, to help address those social determinants of health so that they're then able to get into treatment and stay into treatment. We worked with Giona Johnson previously on that as well. The city's helped to elevate certain initiatives and activities going on in the city. And we certainly hope that will continue through press releases or social media presence, newsletters, being able to promote events, those sorts of things. So we'd be happy to work with anyone, the city and those on the call, in helping us to address these issues so that we can reach those goals of getting everyone tested, and those who are in need of treatment and care into care and staying into care.
Great. All right. Thank you very much. Paul?
Kevin, just some Dr. Frazier, the numbers that we saw, the reporting of those, if they got treated in Charleston County, it really goes to where they live. It's not where they're treated, correct?
Correct. That is correct.
And is there any way that we could dive down a little bit more to understand maybe in certain zip codes within the city or other areas where we have some problem areas that we maybe could put some more attention toward?
I think that's something critical that we certainly can do. And we talked about it, and it's just one of the steps of the many things we need to move toward. We could actually take that data for 21 or 22 and drill down to the zip code level and see how things looked over time. And once we get to the zip code level, then look more progressively and what are the characteristics of the individuals within those particular zip codes. So that's probably something we need to, well, it is something we need to focus on for the future to definitely complete that.
Thank you.
Great. Thank you. Anyone else? Any other questions? Well, Dr. Frazier and Louisa, thank you so much. Appreciate that information. Very helpful to our committee, and we appreciate all the work that you continue to do. So thank you. Thank you so much.
Thank you, sir.
All right, and I'll call on Dr. Katie Richardson now to give us our update, please.
I want to echo that, really thanking Dr. Frazier and Louisa for coming. It's a very busy time for Tri-County SHAPE, with Pride events going on and Project Condom tonight. And so thank you for making the time to do this. In addition to what they shared, I just wanted to mention a couple of things briefly, and then have some other things I can fill in if we have time at the end. But DHEC is splitting, and there will be no DHEC come July 1st. There will be two departments, the Department of Public Health and the Department of Environmental Services. And so we will be getting new emails, new logo, new websites. Everything will look a little different, but I think the important thing to emphasize to this group is that the same customer service, the same services will be offered. There will not be any interruption in services. You can continue to use the same emails until you get an email back that says it's changed. They can continue to use the same websites until you get a message that says, forwarding you to another website. So we will still be here. All the same people will just be under different titles. The board that has been sort of leading DHEC is going to be dissolved, and the departments will then be cabinet positions. Again, as Jennifer mentioned last month, until perhaps there's new legislation that further changes how health related agencies work together. But at the moment, this will be the change happening on July 1st. I also want to mention hurricane preparedness. Last month was National Hurricane Preparedness Month. And as of June 1st, we are in the 2024 Atlantic hurricane season. There are predictions that the season will be busier than usual. And so DHEC and others just want to remind the public to please make or review your evacuation plan with your family. Where will you go? How will you get there? How will your pets be able to be moved or taken care of? Make sure that you have supplies that you may need, non-perishable supplies in your home. Think about your home itself and whether there might be limbs, overhanging your home that may need to be trimmed back, that sort of thing, so that when a hurricane does, we do know days before that the hurricane is coming our way, we will be as prepared as possible to put those plans in place. And then lastly, it is also a time where we begin to see more calls around rabies. That's more, interaction with animals as we're outside more. Bats are active. So rabies is a virus that can be transmitted by any mammal to another mammal through saliva or neural tissue. So any bite or scratch of a person by an animal, either a wild animal or a pet, should be reported to DHEC. There is an animal bite report form on the website. If you're seen for medical care, that provider usually turns in that report form. It just gives us information about both the victim as well as the pet owner. If someone else's pet calls the bite or scratch or a wild animal, we are able to test any mammals free of charge. We do not, though, euthanize pets for this. Because of this, we are able to observe pets. And as long as they are still healthy at the end of 10 days, we know they did not have rabies at that time of bite or scratch. So those are a few of the things that I want to mention today. And thanks as always for having me.
Thank you, Dr. Richardson. Any questions for Dr. Richardson? I did want to mention too, thank you, Dr. Richardson, for all of that and mentioning hurricane season as well. I did want to mention too that Charleston County has updated the evacuation plan. You're going to be seeing a lot of that information coming out, and the city's partnering obviously with Charleston County, and you're going to see a lot of information coming from the city as well. But the evacuation routes have been updated. And of course, you were talking about the animals. The city of Charleston also has an animal control group that works closely with everyone else. But if something happens within the city, we can certainly help from a city standpoint as well with animals. So thank you, Dr. Richardson. Any other questions? All right. If not, we'll kind of go around for our community health and wellness updates. I think Dr. Durst had a few things. I saw some things in the comments, and so I'll call on Dr. Durst first, please.
Great. Thank you very much. Thanks for having me. And also, those were great points, especially Dr. Ferguson and your team. Thank you. That's very important. I know the Charleston Medical Society is working with closing the gap in healthcare with Dr. Bell, especially about disparities in healthcare with the sexually transmitted infections. So we're working on some programs with that. I know he has a radio program that's out and a lot of information. And if any of y'all need a physician to help get the word out, please let us know. We also work with Health Links Magazine, and we have some doctors working on that. So that's great. And then also our biggest news is we have the School-Based Wellness Initiative Awards that came out this past couple of months or couple of weeks, and a Rising Star winner was Charleston Progressive Academy, and their wellness leader is Elizabeth Warren, who's their school nurse, and they have participated in the initiative for over 13 years. And this year they have more than tripled their score from 56 last year to 189 this year. So that's really good. And our grand prize winning school is Stono Park Elementary. Their wellness leader is Tracy Alter, who's their family service advocate for the school. And this is her second year as the wellness lead for the school. Her first year participating was last year, and she scored 245 points and was the Rookie of the Year winner. This year, the school scored 287 points, which is 3 points away from Murray Lassaine's record of 290 points. This is an all-time high for the school, and up until last year, they hadn't participated since 2015 and 2016, and then they logged 56 points. It's also noted that the school that won the Stono Park Elementary had 2 MUSC pediatric doctor residents, Sabrina Archibald and Sarah Olson, who adopted the school and has been working with the school over the past 2 years. So they had a big program. I'll try to get you some information. This is a big thing for the schools. For those of y'all that don't know, the schools add up these points throughout the year doing health initiatives such as getting a garden, working on increasing exercise in the school, not only for the students, but also for the teachers and the employees, and talking about good, healthy habits. This is a big program that Dr. Key, Janice Key, who runs under the Charleston Medical Society, and she's won, or the program has won national awards and many local awards. And I know I've talked about it before, but thank you for your time. We're excited about it. And it'll start again back in the fall. They'll start with the points again.
Very good. And did you say they've had an awards ceremony where they were presented this, or?
Yes, they had it a couple of weeks ago, and I have to get the
Okay.
information. I used to be with like the Boeing or MUSC child advocacy, but I know they have some pictures and all, and I'll get it from them and share it with you guys.
Great. Thank you so much. Appreciate all of that. That's awesome that we had a couple of schools here in the Charleston area do that. So thank you.
Yeah, it's a great program. Thank you.
Awesome.
Kevin, I believe West Elstree High School also won an award this year in the program. I was waiting to see that pictures, but I heard that they had won the award for the high schools.
Okay, great. Very good. Awesome. Well, thank you, Dr. Durst. Appreciate all that work.
Thank you.
And I'll just kind of let, if you want to report out here instead of me calling on you, if you just want to raise your hand, we'll kind of take it that way. Anybody have anything further to report? Jennifer Brush, you usually have something. There you go.
I'm raising my hand. I was like
Thank
looking
you.
for the other hand going, well, I
Yeah.
can just start talking. Well, good morning, everybody. Thank you. I usually do have something to say.
Yeah.
So last month being Mental Health Month, we highlighted a lot of programs here at our center. And I don't know if you all saw us on the news, but we did have our formal ribbon cutting for our 2 crisis call centers, 988 and our mobile crisis call center. And it was good timing for the mobile crisis call center. We had answered over 100,000 calls since we opened that one. And that's our statewide mobile crisis center that deploys mobile crisis teams around the state. And then 988, it was our year anniversary for opening the second 988 call center. And we have done at this point about 4,500 calls where we've actually assisted folks. And probably 1% of those calls were people who were actively suicidal. And we have, knock on wood, been able to save those folks, help them through a really difficult time. And then we follow up with them for several weeks if needed to try to get them connected to resources. So that was kind of exciting. And I think Channel 4 last night, there was a article or a story about our joint partnership with Charleston City Police Department about the CIT team, which is a dual responder. That's a mental health person from our center with a police officer that are going out and working with folks that in the community to divert them from jail, get them hooked to mental health resources. And that was a really nice story that I saw that this morning. And just to remind folks, we have mental health people, and this probably is going to be coming out in the paper too. We have, I think it's 8 different police departments and sheriff's departments, in addition to the jail, where we have mental health folks working really closely with law enforcement. helping, identify folks who need mental health and drug and alcohol treatment instead of having them go to jail. They're working with victims of crime. They're working with advocates, victim advocates. So a lot of really cool different stuff happening here and in Dorchester County to work with our law enforcement folks. So we just have really great partnerships here, and we're really happy about that. And lastly, I will say we have a conference coming up next month in July. It's July 24th, 25th, and 26th. If you guys have not looked at the lineup of speakers, I'll ask Paul to send out that link again. We really have, as usual, very diverse speakers from all over the country, well, world even. And we've got kids that are going to be doing poetry and some music and things at the very end of the conference to talk about their mental health experience from a variety of different schools, different ages. So we're excited, and it's coming up soon. So I hope to see some of y'all there. And if you know anyone, I will mention this, young folks, not too young, but that might be interested in volunteering to help us at the conference, please send me an email, because it takes about 80 volunteers for us to pull this thing off at the Gilliard. And we like to use people other than our staff, because we actually have staff attend, and we also have a mental health center to run during that time. So we don't want it to be all of our staff. But it's a really nice opportunity for young folks, students, interns, it's a really great experience to see the resources. There's so many vendors, but just also to go to a conference of that size, and it's great. So thank you.
Great. Thank you. Appreciate it. Any questions for Jennifer Brush? Well, thank you very much. Appreciate all of that and all that you're getting ready to do and all the time you're getting ready to put in. So thank you very much. I'll call on Dr. Susan Johnson with MUSC.
Thank you. First, I want to say happy World Environment Day. That is a UN recognized day for encouraging worldwide awareness and action to protect our environment. And that theme is going to carry over into my few comments and updates. First, I want to thank everyone who came out and participated in the SE7 events, and in particular, thanking Paul and Carolyn Murray for leading the Charleston side up to the top of the bridge to meet Mayor Haney and the rest of us. It was a great day, and we ended with an amazing resiliency conference. It'll be an annual conference. It was held at Wild Dunes, and the theme was building healthy people in healthy places. So just awesome speakers, and we were really excited to be able to host that. And the South Carolina Healthy Business Challenge received the SE7 Health and Wellness Champion Award. So that was a big win for us. And my only other update is just that MUSC Public Health Department is a recipient, receive funding to support Region 4 public health training. So we are actually a training center. And so my office and my team, we often provide programming for that. And I will be doing a session tomorrow on green health, following nature's path to well-being. So that's at 11 o'clock tomorrow, and it is a virtual session. So I'll put the link to register in the chat, and I will send the flyer if y'all want to share that. But hope to see y'all there. Thank you.
Great. Thank you, Dr. Johnson. Any questions for Dr. Johnson? All right. I see Angela Johnson has her hand raised.
Good morning, everyone.
Good morning.
I just wanted to remind you all that Healthy Tri-County will be hosting the next installment of our Conversations on Race and Health Equity event on June 26th. That's a Wednesday at Royal Missionary Baptist Church. It'll be at 9 in the morning. The topic for this time's conversation is social isolation and its effect on our mental health post-pandemic. So it should be a very very enlightening conversation, and one that I'm sure many of us know someone that was touched by that situation. Also, I just wanted to let everyone know that we now have a community health worker coming to our Berkeley County Resource Connection Center. Once a month, we will have a mobile health unit that will be there. The Roper Mobile Health Unit is coming out, and they are able to provide screenings for blood pressure, glucose checks, and cancer screenings, and they're adding to their services. We also will be having a community health worker who will sit inside the center 2 times a month that can help with patient navigation of healthcare services, social services referrals, and applications for benefits. So just pass the word along, and you'll be seeing us promote that more. But I wanted to make that announcement here this morning. Thank you.
All right, thank you. Meredith Berlinski, you had your hand up and put it back down. Not putting you on the spot. Just wanted to check with you. We're
Yeah,
good.
there we go.
There
Yeah,
you
that
go.
was me. I apologize. I didn't mean to click there to put that back down. Wanted to reiterate what Ms. Johnson was talking about our mobile resource, about our mobile community vehicle. It's rather impressive. We're very proud of it. We've come out to a lot of different sites, and we'll be doing that a lot more for our community as well. And the Berkeley County, our Berkeley Hospital, we just put up the last beam, the top beam. We're ready to work on the internal construction there as well. So the structure is framed and ready, and we're hoping to be ready to receive more patients from that side, especially with Berkeley County and anyone up that way. We're really proud of finishing that, getting that milestone. That's a huge thing. We're going to be ready soon with that, and there's a few other structures in Charleston we're working on as well, and hoping to help the city even a little bit more as well. So there's a lot coming from Rep. St. Francis, and we're excited about that. And love our mobile truck, man. That everybody's really proud of that, and we like to see that out there too.
Great. Thank you so much. Any questions there? All right. Anyone else? I did want to mention that we have Madison James on with us now. She is taking the place of Joey Current with Trident United Way. Madison, if you want to say anything, not to put you on the spot, but we want to welcome you and you know, and let you know we appreciate you being here. So.
Yeah, thanks, Kevin. Really happy to be here. I work with Angela, of course, on all things Trident United Way, but also Healthy Tri-County, and a little bit with Susan Johnson on the Healthy Business Challenge as well. So you'll see my face more and more in the coming months, and feel free to reach out if you need anything. I'll put my contact information in the chat for folks. Thanks.
Great. Thank you so much for being with us. All right. Paul?
Kevin, maybe Morgan could just briefly touch on Charleston Moves or what the May looked like. I saw some really good information on that.
Great. Very good.
Sure. Thanks, Paul. Thanks, Councilman Shealy. So May was Mobility Month with Charleston Moves, which advocates for safe walking, biking, and public transit. So as an organization, it was a great fundraising month. We had 6 events, advocated for over 20 projects, and received just lots of support from the community and from donors. It was a really successful Mobility Month, and just trying to keep the momentum going to consider biking, walking, and safe public transit in all the community planning projects.
Great. Very good. Paul?
And just 2 things. We will not be meeting in July, but Nick Osborne will be doing because we want everybody to go to the mental health clinic that Jennifer and them are putting on. But August will be Nick Osborne will be back to talk to about nutrition and what's going on with feeding the children in our community.
Great. Thank you. All right. Anyone else? And Dr. Frazier and Louisa, I will reach out to the mayor on the Fast Track Cities and see what we can do there to, you know, to with the new administration to make sure that we're helping you out as much as we can there. Okay, so we'll do that as well. Anything else to come before this committee? If not, thank you so much for all your time. This was a great meeting, a lot of great information, and you know, I appreciate your time. And as Paul said, it's going to be a couple months, so I hope you all have a great summer. Stay safe and hydrated, and enjoy your couple of summer months here. And we'll see you in August. So thank you.
Thank you.
Thank you.
We are adjourned.